frequency of escalation alerts. And also what we learned is that the clinicians actually forget to go and log in and check compliance. So now they get weekly emails with summary reports and links to the web page. The next application that we launched, we call it Diabetext. This is really more of a consumer-facing application. As you can see, it's a much more user-friendly format. We kind of looked at the learnings. I remember, when Dell launched the personal computer, they learned people didn't know how to plug in their cables, so they color-coded them. So we kind of followed that logic and said, the left yellow will be basically the count settings summaries. The blue area will be the patient data view, and the green is kind of the communications tools. So what you see here is on the top, you can see the last reported values, which is a BGL of 256 carbs eaten and 5 insulin doses. And then the graph basically shows insulin. You can also check off the other boxes to see the other values. And then you can see it obviously on any portable device. But I want to take you through a quick use case. Let's say a 12-year-old boy is newly diagnosed with type 1 diabetes. What happens today when they're in their school, a nurse will walk in, yank them out of the class, walk them to the nurse's office, check their glucose, take appropriate action, notify the parents. So it's a pretty involved process. The kid hates being pulled out of class a few times a day in front of everybody else. It takes away from the learning process. So the way the system works is, the child will get a text message saying, check your glucose. They'll check their glucose, and they'll respond back with, let's say, if the glucose here is, 200, it will say, they will type G200, hit send. And a few things happen. First, it gets logged online. So there's a continual data tracking. Secondly, it gets automatically forwarded to up to 2 caregivers, which is here on the bottom. Are the caregiver numbers, so there's only one set up for this account. So there's really peace of mind for the parent, and it can also be forwarded to the nurse. And then if the child doesn't respond within a certain amount of time, again, escalation alerts go up. And if the reported values are out of range, if you look at the third box in yellow value settings, there's a low of 85 and a high of 180. So when this person reported 200, an escalation alert would have gone to both the parents and back to the patient saying, your glucose is out of range, please, contact your caregiver. We then launched about 2 months ago an application in partnership with Everyday Health, who is basically a WebMD competitor that offers online health and wellness content. And this was designed for their part of their website, which is targeting HIV patients, and it's a tool for them to help keep track of their medications. You can actually, if you go to eh.carespeak.com, you can actually sign up and try this. And the previous application I talked about, you can try at carespeak.com/beta. So what this basically does is it lets them log their intakes. As you can see, the green dots show that it's been confirmed, and the gray one that it has not. They can set up refill reminders, look at their compliance over the different periods of time, and they can set up their physician and pharmacy information. So when it's time to refill, they'll get a text message with the doctor's information and the pharmacy information. So it allows for immediate action to fill the script. What this does, this is really sponsored by a pharmaceutical company, and what this does for them, it really gives them some interesting data. We can show them how many people sign up and how many are active users. But more importantly now, they can say, for medication X, which is the brand that sponsored it, what are the other medications that patients use? So they can look at competitive products, but also for comorbidities. And then if there's an option for people to enter their zip code, you can also now start looking at their geographic dispersion. So, people just, when I first talk to people and I tell them text messaging, they're like, well, it's only text messaging. But, as you can see, there's a lot of interesting and valuable data that you can really collect with a very simple tool. So, what makes us different? We have put a lot of effort into developing relationships with clinicians. And what this does for us, it really helps us validate the clinical efficacy, which is very important because whoever pays for this service, and I'll talk about this a little later, needs data to justify that there are positive outcomes. Secondly, all these top-notch clinicians that, as you see, some very reputable institutions are now part of our R&D and product development team, and we really learn a lot from them and their patients. And it certainly gives us credibility as a company. some of the things we're working on currently in our planning are, we talk about transplants. So we're deployed now at Mount Sinai for liver and at Columbia Presbyterian for heart transplant. We're also working on the obesity program, HIV, as we talked about, cystic fibrosis, asthma, and type 1 diabetes. So these are programs that are kind of in development now, and there's some other ones that we're discussing. The other differentiator, and this is probably my consumer packaged goods background, is what they teach you at the J&Js of this world is, really understand where the consumer need is and try to meet it. Don't try to design a cool product and retrofit it into consumer behavior. So we're now working with one of, probably the best-known design companies, industrial design and process design, to understand, what is that journey of the patient as they go from doctor's visit to the pharmacy to their everyday life, and what are kind of the pain points that affect, compliance or non-compliance, and really trying to provide them with tools that, fit that workflow, fit that everyday behavior to help them meet these things. And some of the learnings, just, for example, what we learned is most people get the alerts between 6 and 8 a.m., right? Which is great during the weekday, but at weekends, they really get ticked off when they get woken up. So we kind of added a feature that could give you a, what we call a weekend time delay. We also learned that some people prefer to get one message versus multiple messages. So if you have 3 meds at 8 a.m., some people like 3 different messages, and some people just want one message. And then also we learned that, different people, depending on the medication, need more time. Somebody needs less time, so needs more time to get that refill alert, right? So these are just little kind of tactical implementations of learning and working directly with the patients. The other thing we did, we partnered with Everyday Health. So, they are one of the leading content providers in healthcare, and we get a lot of learning from them. We get some good content from them, and they do a good job promoting us. So that's certainly very helpful because they have all the relationships with some of the stakeholders here. Some facts on text messaging. I don't know if you know this, but a text message on average is read within 4 minutes of receiving it. So as you can see, there's an immediate communications impact with the patient. There's twice as many people active in using text versus emails, and about 2/3 of mobile phones users have a text capability, whether it's a prepaid phone or a plan. A lot of people talk about, well, kids are the ones who text message. How about adults? So Pew just came out with some data, I think, in September that shows that actually there's a significant increase. So just in a 6-month period here, adult usage of texting increased by 7 points, right? Yeah, 7 points. And you can see that adults send a median about 10 text messages versus 50 for kids. But what I thought was interesting, there's a direct correlation in texting and voice usage. So, people ask us, well, can you do IVRs? Yeah, we can do IVRs. It's a simple plugin for us. We chose not to do it because, if you get a call and saying take your medication, by the time you go from your phone to your cabinet, you might, I don't know, get distracted by something and start another conversation. Now you don't, did I take medication or not? If you get a text message, it's still on your phone until you delete it. So you have some kind of a record telling you, what your actions have been. And then obviously you all know this, that this is pretty intuitive. If you have kids, you're more likely to have a cell phone because that's a great way to keep track of them. We've seen a lot of, we hear a lot about apps, and I own an iPhone and an Android phone and a BlackBerry, and there's some really fantastic apps. There's no doubt about it. But the reality is that the majority of people cannot afford this, and I want to kind of highlight some of the differences. So first of all, SMS is more reliable than data. And a great example of that is that during the Katrina disasters, the only communications that consistently worked was text messaging because it only requires intermittent signal to push it through. Secondly, it really works on any phone and any carrier. Like in the US, the only provider is, only track phones don't allow for text messaging. But other than that, like 99% of phones and carriers accept text messaging as a communications method. So it also doesn't require any additional hardware. No downloads needed. I mean, other than the iPhone, I haven't had really any good experience in downloads, especially when it comes to the BlackBerry. And not to mention some other Java-based apps on the old generation of smartphones.